Doc, let's talk about another alarming discovery. There's a drug-resistant fungus. It was identified in Florida and Georgia hospitals, as well as 12 other states. You're a practicing physician. You make rounds at the hospital. Tell us about this fungus and how dangerous it could be.
Well, this could be a nightmare for hospitals and physicians that are treating these immunocompromised sick patients. And the reason for that mainly we worry about is that this is a multi-resistant drug fungus. It was first discovered in 2016 in the US, and now it's in all but 12 states in the United States. What happens when you discover this infection is you have to rapidly isolate the patient. That's what's key. And you have to make an attempt at some of these common antifungal medications. But the problem is it tends to be resistant. So really what hospitals should do, and what hospitals do all the time, is rigorous infection control. And like I said, isolate the infected patients and be extremely aggressive with cleaning protocols. And that's the way to combat this very dangerous infection. And like you mentioned, the CDC is calling this fungus an urgent threat. It is drug resistant. How could this affect a patient's ability to fight this infection off? You know, if you're immunocompromised and you are really sick, and say you're on a ventilator or you have a catheter, then these organisms can seep in through the body that way. And if you're already sick, it could be very difficult. It could be a nightmare in an ICU setting to actually treat these patients because they're already sick. And now they have a potential infection where normal medications don't work. Let's move on to another study. It's about aging. It found the best way to age without developing chronic disease is to eat primarily a plant-based diet. Tell me more about this study. Should I stop eating meat? What does this mean? Yeah, I think, here's what I think was key about this study. Number one, it looked at over 100,000 people between the ages of 40 and 70, and it followed them for over 30 years. We do have a lot of studies on healthy diets, and we know that if you cut down on alcohol consumption, you stop smoking, that you can live a healthier life. But this is really the first study, Hena, that talks about how the quality of life could be in your 70s, that it is not inevitable that you develop high blood pressure and diabetes just because you are an older individual. And to answer your question, the study also did address that it's not necessarily about giving up meat, it's about cutting back on meat, getting adequate sleep, socializing, eating a healthy diet. And you could potentially get into your 70s without this anti-aging effect, or with actually the anti-aging effect, meaning that you're not depressed, you have good memory, you're able to climb a flight of stairs and basically live your life. So this is very reassuring. Yeah, actually, I feel a lot better hearing more about that study. Dr. Saju Matthew, thank you for coming on.
Thanks for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.